Welcome to another episode of Mental Tough Zone. Subscribe now so you never miss out on any of our latest uploads. Let's get into the video. In an effort to clear up common misconceptions and promote increased awareness, we present 15 important facts about mental health. Millions of Americans fight mental health problems in silence every year. The purpose of Mental Health Awareness Month is to encourage open communication as well as to defame the condition by developing and implementing effective treatment modalities. We hope that these 15 facts about mental health will encourage you to talk to them about the issues you care about. 1 in 5 Americans has experienced some form of mental illness, with 1 in 25 experiencing serious mental illness, such as bipolar disorder or schizophrenia. 2. Suicide accounts for over 800,000 deaths globally each year, with over 41,000 in the U.S. alone. It is the second leading cause of death worldwide for 15 to 29-year-olds. 3. The rate of mental health disorders doubles for those who have been to war or lived through a major disaster. 4. People with a mental health issue are generally nonviolent. In fact, only 3 to 5% of violent acts can be attributed to people with a serious mental illness. 5. Many factors can lead to mental illness, including genetics, physical illness or injury, and traumatic life experiences. 6. Many people do not seek treatment for mental illness due to the associated stigma. Only 44% of adults with diagnosable mental illnesses receive treatment. 7. Treatment for mental health problems doesn't only consist of prescribed or OTC medication. Therapy, yoga, meditation, and holistic treatments can all help to assuage symptoms. 8. By addressing risk factors such as trauma, it is possible to prevent certain mental health disorders, especially in children and adolescents. 9. Improving mental health services in low to medium income countries is not as costly as some may think. An investment of only $2 to $4 per capita would have a major impact on millions of lives. 10. Each year, serious mental illnesses cost the U.S. almost $200 billion in lost earnings. 11. 50.5% of adults in the U.S. who have had a problem with substance abuse also suffer from mental illness. 12. 20% of youth have a mental health condition, with 1 in 10 young people having experienced a period of major depression. 13. Members of the LGBTQ community are twice as likely as straight individuals to have a mental health condition. 14. 70 to 90% of people who seek proper treatment for mental health disorders witness a significant reduction in symptoms. 15. Last but not least, most people living with mental illness lead productive lives despite their challenges. Mental health and substance use challenges look different for each person affected. No challenge or diagnosis is exactly the same, and some mental health challenges can be difficult to recognize. It can be easy to generalize or make assumptions, but realities vary, and these challenges can impact more than you may think. Studies show that mental health in the United States is worsening among all age groups. While this is because of a number of factors, one fact stands out: many people are not receiving the treatment they deserve. Stigma around mental health and lack of access to care are driving many people away from getting the care they need. Over the years, a great deal of work has started to reduce the stigma of mental health, and there's been progress in making these conversations feel normal. Today, as COVID-19 has impacted all of us in different ways, discussions around mental health are becoming increasingly common, and more people are reaching out for help. These statistics will help you better understand what mental health and substance use challenges look like in 2020. 1. 40% of U.S. adults reported struggling with mental health or substance use. 2. 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder each year. 3. Half of all lifetime's mental illness begins by age 14, and 75% by age 24. 4. Depression alone costs the nation about $210.5 billion annually. 5. The average delay between onset of mental illness symptoms and treatment is 11 years. 6. Suicide is the second leading cause of death among people aged 10 to 34 in the U.S. and the 10th leading cause of death in the U.S. 7. Many people suffer from more than one mental disorder at a given time. In particular, depressive illnesses tend to co-occur with substance abuse and anxiety disorders. 8. More than 70% of youth in the juvenile justice system have a diagnosed mental illness. 9. Transgender adults are nearly 12 times more likely to attempt suicide than the general population. 10. The most common mental illnesses in the U.S. are anxiety disorders, which affect 40 million adults, 18.1% of the population. Mental health and substance use challenges affect everyone differently, and recognizing when to get help yourself or offer support to someone else is an important step in changing these statistics for the better. Myths about mental health. 1. Myth: children don't experience mental health problems. Fact: even very young children may show early warning signs of mental health concerns. These mental health problems are often clinically diagnosable and can be a product of the interaction of biological, psychological, and social factors. Half of all mental health disorders show first signs before a person turns 14 years old, and 3/4 of mental health disorders begin before age 24. Unfortunately, only half of children and adolescents with diagnosable mental health problems receive the treatment they need. Early mental health support can help a child before problems interfere with other developmental needs. 2. Myth: people with mental health problems are violent and unpredictable. Fact: the vast majority of people with mental health problems are no more likely to be violent than anyone else. Most people with mental illness are not violent, and only 3% to 5% of violent acts can be attributed to individuals living with a serious mental illness. In fact, people with severe mental illnesses are over 10 times more likely to be victims of violent crime than the general population. You probably know someone with a mental health problem and don't even realize it, because many people with mental health problems are highly active and productive members of our communities. 3. Myth: people with mental health needs, even those who are managing their mental illness, cannot tolerate the stress of holding down a job. Fact: people with mental health problems are just as productive as other employees. Employers who hire people with mental health problems report good attendance and punctuality, as well as motivation, good work, and job tenure on par with or greater than other employees. When employees with mental health problems receive effective treatment, it can result in lower total medical costs, increased productivity, lower absenteeism, decreased disability costs. 4. Myth: personality weakness or character flaws cause mental health problems. People with mental health problems can snap out of it if they try hard enough. Fact: mental health problems have nothing to do with being lazy or weak, and many people need help to get better. Many factors contribute to mental health problems, including biological factors such as genes, physical illness, injury, or brain chemistry. Life experiences such as trauma or a history of abuse. Family history of mental health problems. People with mental health problems can get better, and many recover completely. And with that, we've reached the end of this video, all about fun facts to do with mental health. For amazing once-in-a-lifetime offers, click the links in the description. Do you suffer from mental health? What tips do you utilize that we didn't mention? If you enjoyed this episode and found it helpful, don't forget to give us a thumbs up and to subscribe to our channel for more content just like this.